Let's jump into today's episode, the PPO Umbrella Nightmare. This is a topic that has become even more popular in the last year or so, more so than it used to be. So Gary, talk a little bit about why you decided to talk about this. Like, what motivated you?
Well, the reality is that many PPO plans are not siloed. The term silo is a term that we use to describe independent PPO plans that are not connected with any other networks. An example of a silo PPO plan would be Delta. Delta is its own PPO plan. They aren't networked with any others. However, over the years, the silo format has become much more unique and unusual in PPO plans. Naren, like every other business, the PPO insurance companies have learned that they can effectively outsource the administration of those plans. And they can outsource them to someone else for two reasons. One, to simplify the process for them. And secondly, they usually experience some cost savings when they outsource administering those plans. In other words, they're able to find a source to outsource them to lower the costs. Now, don't think for a minute that they pass that savings along to you, doctor. No. Naren, where do you think the savings go? So if a PPO plan used to spend $100 million a year on administering their PPO plans, and now they're able to outsource them to a third party somewhere, another PPO plan, and that cost goes down to $75 million instead of $100 million, where does an extra $25 million go?
It's definitely not going to the dentist.
Not going to the dentist. We know that's not going to the patient in terms of any more benefits. And I doubt very sincerely whether it's going to the great team members that work for the PPO plan, answering the phones and helping you with your claims. So who does that leave?
Probably the executives who run these, large.
Well, you used a nicer
like
term. I'm going to use the term fat cats. The extra 25 million went to the fat cats at the PPO plan so they can line their pockets with more tens of millions of dollars. Now, what does that mean to you? What that means to you is that very often you'll discover, if this is something I encounter daily in my work as a coach. When I'm starting to work with a client, I'll ask the office manager, how many plans are you contracted with? And the office manager will typically say, well, Gary, I think that number is around maybe 12 to 15, but I'm not entirely sure. And then when we unpack it and discover through research, when we discover how many plans are actually contracted with, those 12 to 15 often become 30 to 40 PPO plans because of the umbrella nature of the plans. And when you go to resign from an umbrella, it can be a bit of a tangled web, a very tangled web. In some cases, you can successfully, let's say that MetLife is under a United Healthcare umbrella. And I'm just using this as an example. But let's say in your state, MetLife is umbrellaed under United Healthcare. In some cases, you're able to resign from MetLife independently and not affect any of the other plans in the umbrella. In other cases, when you resign from MetLife, in order to resign from MetLife, you have to resign from every other plan in the umbrella. And all of a sudden, it becomes much more complicated to have all your ducks in a row to make sure you're ready to pull that trigger. Because if there's another 7 or 8 plans in that umbrella, it's a much bigger project as relates to your practice. In other words, we have to communicate with all of those patients in the umbrella plans, not just the MetLife ones. Is that making sense, Naren?
Yes.
But it's not consistent. And that's where, some professional help might be useful for you in that regard, because it's not consistent. There's no consistency across the United States on how this is handled. It's very unique, and it tends to be driven by your state and then also the regulations within the umbrella plan. So it becomes a bit, and there's really only one way to accurately describe it, which is why we chose the title of this episode. It is a nightmare. It is a nightmare. I'll give you an example, Naren, that cropped up recently in my coaching work. So this is an office, really nice office in the Midwest. And they were contracted with Delta, of course, and then had a couple of other silo plans. But then the majority of their plans, about 15 of them, were in an umbrella. And as we started to look at what plan to resign from first, if you're a regular listener to the Less Insurance Depends podcast, you know that I like to start with, when we start resigning, start with a smaller plan, a plan that has the smaller number of patients. It's a way to kind of test drive our readiness for this, test drive your team members' verbal skills, our preparedness and readiness to do that. And then based on that, we can move up the ladder and keep conquering the plans that have a higher number of patients in your practice. But in this case, all of the smaller plans were under the umbrella. Everyone that had less than 100 patients, this is a big practice. Any plan that had less than 100 were under an umbrella. And when you added them all up, they were actually larger. The number of patients in the umbrella plan were larger than Delta. So in this case, we went off script and resigned from Delta first, because that actually represented the smaller number of patients in their practice. Normally, we don't start with Delta. Normally, we finish with Delta.
Right.
But in this case, because of all the information we had, and again, in this particular state, when you resign from any plan within that umbrella, you had to resign from all of them, or your resignation would not take effect. So you had to resign from all of those. So it steered us to our specific strategy within the resignation process, and it steered us to go very much off of our normal blueprint, which was to resign from Delta first. By the way, we've had enough time with this practice to see the result, and they have seen fantastic results. I did a debrief. We've recently passed 8 months since we resigned from Delta, and I recently did a debrief with the owner doctor, and she said, Gary, it played out just like you said. We lost patients, but we lost way fewer patients than I thought we would. She said, I really thought we'd lose more.